Hey, what's up? It's Dr. Mike Geran from Foothills Chiropractic here, and I am talking about shoulders today. This is a webinar about shoulder pain and how I can help and how I've been helping people with shoulder problems for nearly 30 years. So I'm from Foothills Chiropractic here in Travelers Rest, South Carolina. Been here in this office since 2010. I've been a chiropractor since 1997, so that's nearly 30 years of taking care of patients. And I know a thing or two, especially about shoulders. You see, I've been blessed to have learned a lot from my mentors and coaches throughout the years. And one of the things that I've learned a lot about is extremity adjusting shoulders, elbows, knees, wrists, fingers. And I see a lot of shoulder problems. There's a lot of people out there that have shoulder issues, whether it's you name it, whether it's, you know, problems in the shoulder joint itself, whether it's problems in the front or down the arm, whether it's problems in like the back, upper trap, shoulder area. It's all shoulder stuff. And I've been expertly trained on how to take care of shoulders. Actually, in the next 12 to 24 months, I will be speaking at conferences teaching extremity adjusting. And specifically, one of the things I'll be teaching is how to adjust shoulders. So I will be training other chiropractors on how to adjust shoulders. So I know my stuff when it comes to shoulders. So let's talk about some of the, for lack of a better term, BS that's out there about shoulders. And one of the big misconceptions is that drugs actually help the shoulder. Drugs don't heal anything. So if you're taking dangerous drugs, if you're popping Advil or Motrin every single day and killing your kidneys, or if you're taking Tylenol every day and you're killing your liver, or if you're taking Celebrex and killing a whole bunch of stuff in your body, it might make the shoulder feel better, but it does absolutely nothing to fix the shoulder and help heal the shoulder. I'm not saying you shouldn't take them because I'm not a medical doctor. I can't really advise you on whether to take drugs or not. But I can tell you that drugs don't really fix the problem. They just put a band-aid over it and let it get worse. So that's the first misconception, is that you have to take drugs if you have shoulder pain. Second one is this thing about tears in the shoulder. Now, sure, if you have a massive rotator cuff tear and you can't move your arm, surgery might be the only option. I don't discount that. I've seen patients of mine that there's been a few over the past 30 years that for whatever reason it just didn't get better, and they had to go get shoulder rotator cuff surgery. But there's a lot of people that have been told and diagnosed with a torn, partially or fully torn rotator cuff, and they're told surgery is the only option. But I've seen them in my own office get better with chiropractic care. And honestly, there's a lot of people walking around right now that have torn rotator cuffs and don't have a lick of pain anywhere in their shoulder. So explain that to me. And the explanation is that there are other things besides a tear that can cause symptoms. If the shoulder's not lined up and moving right, that can cause inflammation and pain. That's the other thing is, we talk about bursitis or tendonitis or any other scary name that doctors put on problems. The reality is, bursa is just the sac that the shoulder joint's in. If it's inflamed, itis is inflamed. So it's just an inflammation of the joint. Tendonitis, I know that sounds really scary too. Tendon is the part of the muscle that connects to bone. If it gets inflamed, mostly due to improper mechanics of the joint, it becomes an itis. So tendonitis is inflammation of the tendon. We see it all the time. I see it all the time. People come in here with these scary names and they're terrified of it. It's just inflammation. And if we can get the joint moving better and we can get the body working better, 9 times out of 10, 98 times out of 100, it's going to fix it. Body's going to heal itself. So as a chiropractor, I just do my thing. We get the body working better and the body can heal. It's very, very simple. So here's what I do to help shoulder problems. And there's a couple things that I do. We look at it three different ways. So the first thing we want to do is we want to make sure that everything is in its proper place in the shoulder. So you have the humerus, you have the collarbone, you have the shoulder blade, aka the scapula. We want to make sure that all those bones are where they're supposed to be so that the joint can move properly. Just doing that by itself will help a lot of people. And I use a bunch of different techniques. I use my hands to manually adjust the shoulder. The instrument I use, the Polestar, we can actually adjust it without even doing any cracking or popping in the shoulder. So there's a lot of different ways that I adjust the shoulder. But the whole goal is to get the bones where they're supposed to be in the shoulder. When I do that, we're off to a really good start. The second thing we want to do is, as a chiropractor, I understand that the nerves in the neck and in the upper back go into the shoulder. So if there's bones that are impinging nerves going into the shoulder, that's also going to cause problems too. So that needs to be cleared up too. So not only are we making sure that all the bones are where they're supposed to be in the shoulder so that it can move properly and the muscles can relax, we also want to make sure that there's proper nerve flow from the neck and upper back into the shoulder too. So that's the second thing we do. Third thing is I practice the zone technique. And the zone technique, the primary goal of the zone technique is to balance the body. When you have a body that's balanced, it's going to function and heal like it's supposed to. So I could do the first two things. I could make sure that there's no nerve impingement. I could make sure that the bones are where they're supposed to be in the shoulders, moving right. And that would probably help a lot of people. But the third component is perhaps the most important component, which is making sure that the brain and body is balanced. Because unless the brain and body is balanced, it's not going to heal exactly like it is supposed to. So we do the zone technique. I feel the back of your head. There's 6 points in the back of your head. They all relate to different systems in the body. I will find which systems are not balanced. We do adjustments to balance the body. So those three things, I help a lot of people with shoulder problems. And I don't fix the shoulder for them. I just improve how their shoulder's functioning and how their body's functioning, and they're going to heal. So I don't fix anything. I don't heal anything. But I put the body in a position and a state so that it can heal itself. So those are the main things we do with shoulders. Next steps, if you are dealing with shoulder problems, and that also includes upper back stuff too. So if you've got upper back and trap stuff that feels like it's kind of in the shoulder, I help that too. For the same reason, I do the same three things with any joint that's having problems. So next step is, if you're having shoulder issues, I definitely encourage you to book an appointment with me. Come in, let's have a consultation. If it sounds like it's something I can help with, we'll put you on a plan of care to get you better. And it will probably take some time. It will probably take some repetition. It'll probably take some effort on your part. And the way we run our office is we make it really easy and affordable for people that have problems and they want help. So book an appointment with me, get in, and I'm pretty darn certain that I can help you. Thanks for watching.